The next morning, when I woke up, I said to there was a male nurse, I said, "Man, I feel great." And, I'd woken up every morning for about 3 years feeling wretched, just getting worse and worse. And I woke up, I just felt great. And every morning I wake up now, I feel great. The change was unbelievable. Immediately.
It works straight away, and I was expecting it to work after about a week or two. But it works within days. When you wake up, you just feel fantastic.
The first thing I noticed was I was obviously bedridden for maybe a day and a half or 2 days, but eventually when I did manage to stumble up and make my way to the bathroom, so to speak, and looking into the mirror, the first thing I noticed was my skin complexion and just how it changed. It's always strange because you can always tell a dialysis patient, and it's only a dialysis patient or maybe a nurse as well that can tell someone that's having that treatment, because your skin just turns a darker shade and a funny sort of tinge to it, and it had just gone, and it was just amazing. I mean, it was really, really painful. I'm not going to lie, you don't get nothing without a little bit of pain, but you could just feel the difference. I just felt better in myself.
My mum noticed that straight away afterwards. She said I looked pink, whereas before I always looked quite grey. So as soon as I had my transplant, she said you've actually got colour, which was really good.
Within a few hours, actually, I was compos mentis. I was fine. I was talking to people. My parents were there. I felt okay. And although I'd been advised that what would happen, if I remember rightly, there's a period where you sort of reach a bit of a low and then you start to come back quite quickly. Well, the first day or so I was fine. It was on the third day I hit an all-time low, where I think the drugs had taken the toll, and I was really feeling quite miserable, and I'd actually broken out with ulcers and things like that. But I think it was just my body reacting to the medication. It was almost like jumping on I hit a low. It was almost like jumping on a trampoline, because as soon as I'd hit it, that was then I felt that was a real positive recovery after that.
I woke up from the transplant and I was just buzzing. The next few days, Gary was hitting his low, I was hitting my high, and I was wanting to go and visit him in his room and walking around as much as I could.
My sister had moved in with me for about 3 or 4 days, and I was incredibly grateful for that. Just silly things like opening the curtains I struggled with. She always had my breakfast ready, made sure I was eating them properly. Once my sister moved back home again, my mum would come in every afternoon from work, pick me up, and we'd drive different places just to get me out of the house, starting to get me mobile and encouraging me to move to help with the pain management as well. And that helped a lot. I came off the paracetamol a lot quicker than the doctors had recommended, because I found out I didn't need it anymore, because I'd been encouraged to move and get out and be mobile.
I took 3 months off work actually after the surgery, which I really did need. I was doing some work at home, but not really able to do an awful lot. I just got so tired. But then I was back at work after about 3 months.
I thought it'd been more pain than I was. I thought it would have taken more of a toll on my health than it did. But in the recovery period, I didn't feel half as bad, a quarter as bad as perhaps I was expecting I could have done. And once I sort of went back to work and got back into the normal routine of things, I barely noticed anything.
When I got home from the transplant, it was the start of the summer, and I just wanted to be up and outside. And when I had visitors come to visit me, they was telling me not to get up, sit down, they'll get it, and I just wanted to be up and about and getting active again. So I couldn't wait to get outside in the sun.
Beforehand on dialysis, you just feel rubbish the whole time. Then afterwards, you feel like you get your life back practically. And I can go out and I can do what I want. I can go on holiday and things now that I couldn't do before.
Even with the dialysis, the fluid restriction was the worst thing, because I used to be constantly drinking fluids all day, and then to cut it down to a litre a day, that was really hard for me. And although in the first few days after the transplant, the doctors were saying you have to drink like 4 litres a day, and I was struggling to keep up with that. I thought I'd be able to just leap right back into it, but it was a bit of a struggle at first. But now I'm drinking like 2-3 litres like a day, so that's the best thing, I think. And also being able to eat cheese. I missed that terribly, and now I'm all over that now.
We've got more freedom as well.
Yeah.
We're not time restricted with his dialysis. We can go out when we want. We can go out to restaurants and eat where we want. It's just a lot more freedom than we had before.
Yeah.
I was cycling to work again within 8 weeks, and I was doing a run. I was out running. At first I could only run and walk for up to 1.5k, but then eventually I got it up. Now, just a year and a half, 2 years after my transplant, I'm getting personal bests at everything, and I'm older. I'm 42 now. I'm getting better times now than when I was in my 30s. So the new kidney has really sort of lifted my life and turned things around. I'm a police officer and a firearms officer, and to be told that I'll never be frontline again, I'll definitely never carry a firearm ever again. To be told that, and the possibility of being pensioned out of this police service, from that to now, where I'm the fittest person on the team of 20. I'm the fittest there. I'm doing a half Ironman this year. I've got my firearms back, my firearms licence back. I'm frontline policing, probably more frontline than most because of the people I deal with. And my quality of life is just fantastic.
I haven't just turned up in a suit today for the camera. It's because I have a proper job now, which I definitely wouldn't have been able to do without. If I was still on dialysis, for example, I couldn't have. I had to leave my last position for it and get something that worked around being on PD. So it's given me a lot of freedom. I can travel again. I just went to France a couple of weeks ago for the first time since I had, for over a year, been out of the country.
I'm happy to say I am now back at work full time and ready to go, and I'm also back at university. I was studying before I fell poorly, so I had to take a couple of years away from university, but no, everything seems to be going back to normal and back to normality.
My quality of life after donating a kidney is exactly the same as it was before, apart from the fact that we've no longer got a chronically ill son, so that's clearly a huge bonus. For me personally, to be honest, once I'd recovered from the actual sort of procedure itself, I'm completely unaware of having just the one kidney now.
It's only just been 6 months since I donated the kidney, and I just had the annual follow-up meeting, and everything's fine. Everything's sort of still, everything's back to normal now, and so now it's just going to be a case of every year I come back in and just have bloods checked just to make sure everything's fine. Just basically get sort of a general MOT, check my weight, check my blood pressure, and which, to be fair, I think is one of the things that people should be looking after anyway.
Having a blood group incompatible transplant, I think Dr. Newstead outlined the differences beforehand, saying that after 6 months post-transplant that it would behave like a normal transplant, and I think that was the case. I think they were super sensitive to any changes in my readings from my blood tests after the transplant, hence me being called back a couple of times for tablet changes and things. But I think after that there's been no change at all. I come back now to have checkups every 3 months, and nothing really changes from one visit to the next.
8 months after my transplant, I entered, because I'm a keen cyclist, I entered transplant games, which were at Sheffield, and I did the 5k time trial and got bronze medal. So I was chuffed with that. So this year they're in August, and I've been training towards, I want to win gold in time trial and gold in road cycling. And that's what I'm aiming for. And there's absolutely no reason on this earth why I can't do it.
The operation, it's a little bit like a magic trick. As long as it works, and obviously it doesn't always work, we know that, but I think medicine these days makes it more likely than not that there's chances of altering people's life tremendously. And it's like you go into a theatre, 2 people, you come out, and there's no side effects particularly to the person donating. It's not a backward step. My life's continued probably more fuller, because I feel I've done something that's quite worthwhile.
Appreciation of life.
And I think to see the end result of the recipient, it is like a magic trick.
I've felt absolutely wonderful ever since, in terms of its effectiveness. Life-changing. Life-saving and life-changing.